The individual that has tested positive for the virus is in Lexington and is currently being treated in isolation. This was a result from a test kit that the state lab ran, and we just got the results today. While the overall threat to Kentuckians is still low, we as a state are going to take every necessary action to protect our people. So about 5 minutes ago, I filed a state of emergency so that we would have every tool that we could need to address this issue and ultimately to protect our people. We have activated the Emergency Operations Center. It is currently at level 4, which is our lowest level, but it is up and running. We're further repurposing our poison control unit hotline, and we are awaiting the number that generates, but that will be available for any member of the public who is concerned to call in and to speak to one of our people. Again, we have had 10 tests. 9 have been negative, but now we do have the first positive. The only information about the individual that we'll be releasing today is that they're in Lexington. We need time for our epidemiologists to focus on them, focus on potential contacts, but we will be transparent in providing more information through the weekend and into next week. To our Kentucky families out there that are nervous, this is what we've been preparing for, and we are ready. There is no need to panic. I get that it's scary. I'm the dad of 2 great young children, but we will face this. We will face it together. We have amazing healthcare providers in Kentucky that are ready to respond. We will protect each other. It is important now that we have the first confirmed case to know that we should expect at least one other confirmed case at some point in Kentucky. That's what we are seeing. But that doesn't mean that we can't protect our people. And the main way to do that is to practice good hygiene. So make sure you wash your hands with soap and water. Wash them often, wash them well. Make sure that if you are feeling sick, you do not go to work and you do not send your kid to school. And then make sure that, especially for our seniors that are out there, that if you're feeling sick, that you do not visit them in any type of facility that they are in. We didn't want to see a confirmation in Kentucky, but we knew that it was coming. We are ready. We're going to be making information available to the public, and with this state of emergency, we now have every resource available to us to respond. More information will be coming, but rest assured, everything that we can do here as a state, and I know for every local health department and every other person that is in healthcare providing assistance, that we will step up, we will help our people, and we will eventually move beyond this coronavirus. Any questions?
Governor, can you give any background? Did this person travel from somewhere or anything along those lines?
We will be releasing more of that information, especially through the weekend. But when we just got this test back today, we very much need our epidemiologists to be able to do a little bit of research on those ties and any other issues before we can release that information to the public. It's the responsible way to do it. And we want to make sure that we release any and all information in a way that is transparent, but again, does not and should not cause panic. Panic can be just as harmful as any type of virus that's out there. So people should not adjust their daily routines other than practicing good hygiene, not going to work if you're sick, not sending your kids to school if they're sick.
Governor, what can you tell us about this patient? Is it a man? Is it a woman? What are the age range?
Right now, the only information we can provide, given we just got this test back and we need to let the epidemiologists get out ahead of this, is that the individual is in Lexington. They are being treated in isolation.
You said whether they're at home or in a hospital or medical?
They are in a medical facility being treated.
So it's okay for Kentuckians this week to go to basketball games, churches?
At this point, with the information we have, yes. Kentuckians can and should go to churches, to basketball games, but Kentuckians who feel sick absolutely should not. That's one of our responsibilities, as this is one case, and we knew it was coming. Again, the flu has, I believe, 19,000, around 19,000 confirmed cases this year. And so we want to respond appropriately. I've declared a state of emergency, so we are definitely responding. But again, we want to keep it in context. People should go about their daily lives, but practice better hygiene.
Are you confident in the results? I think the state just
Yes.
did some testing, right?
Yes.
So you verified.
We are confident that this confirmation is accurate. This is our first case of coronavirus.
Do we know if it was contracted in Kentucky?
Well, again, we're letting the epidemiologists get out ahead and gather the information so that we can respond appropriately.
And so with that, with epidemiologists, how they respond, what does that process look like? What are the next steps of that process for you?
So I'm joined today by our secretary, Eric Freelander, and Dr. Stack, who heads public health. I'm going to turn that over to him.
So the epidemiologists will now go through a really methodical process. They'll identify more information about the patient who's currently being treated. They'll identify where that person was leading up to the illness and until the time they were being treated. They'll find people they were in contact with, any potential travel history. It's called contact tracing. And so they do a very detailed, very methodical approach to identify everybody that person may have come in contact with, the places they may have been, any possible source and any possible exposure to the illness or that they might have exposed someone else. And then they'll work with local public health officials and other clinicians as needed to make sure that they have the information necessary to try to recommend any additional steps necessary for isolation or other interventions in the community.
And as of right now, our repurposed poison control hotline number, which is now our COVID-19 number, is 1-800-222-1222. That is 1-800-222-1222. That is the number for the general public, especially those that have concerns, to make sure that they can communicate with us directly.
When you declare a state of emergency, talk about exactly what that sets in motion, what happens from that.
That sets our Emergency Operations Center in motion. That connects to all of our cabinets and all of the powers that they have. It sets up a central coordinated response. It also allows the activation of the National Guard when and it should it be needed. And I won't hesitate, if we do, to lean on the National Guard and its resources, which can also be used. But at this time, it is a single case. It was expected. Declaring a state of emergency certainly doesn't mean any family should panic. It just means that we're going to be ready, and I want to make sure that every single resource that we could need, we have right now.
Does this set in motion, like this individual, you try to find the whereabouts, where this person has been, who they contacted, or is that just almost impossible to do?
Dr. Stack?
Well, it's not impossible. They do it to the extent that the information is possible and obtainable. So it's very thorough. And public health professionals have used this for a very long time as a reliable way to identify how a disease originated, where it may have spread, and steps to take to recommend as targeted as we can what community interventions are necessary. But I want to emphasize what the governor said. We knew this would happen. There's only one case, and still Kentuckians remain at very low risk for contracting this illness, and the current individual is in isolation receiving treatment.
Are you all doing anything for your correctional facilities, juvenile justice for people living close quarters and confined?
You know, all through state government, including in our own personnel cabinet and for our employees. We are working daily on best practices and preparation. We are certainly telling everyone to be alert for the signs, but we don't have any reports from those facilities, at least to my knowledge, as I stand here right now, of anybody exhibiting any of the symptoms that would raise concern.
Has Kentucky put anybody in self-quarantine? Have y'all
Oh,
got a number?
we-
What's the number on that?
Well, I believe that we had been following a little over 100 folks, more than 88 of them, I believe.
Yes, and almost all of them are.
Almost all of them have been cleared. And the requests for self-isolations have gone very well. The only people who have refused were at very, very, very low risk. And so it appears to be a very effective tool. But we do have other tools, if necessary, to ensure isolation if someone is at high risk and refuses. Chris?
Just yesterday, the Congress passed some federal funding.
Yes.
Have you already tapped into that, asked a major request?
Well, we have some that is coming our way under that bill, and we will have more that we will request as needed. We're going to use every resource that we need, and if I have to go to the legislature for more state funding, they're here. That is something that we're exploring, not that we know it will be necessary, but we need to have every tool to respond, and so I may ask them, given that this is going to play out over a length of time longer than the legislative session, for some flexibility on using funds if they're needed. Our goal is every tool that we need, we're going to have. And the state of emergency provides almost all of that, but if there is any other thing that we can be doing, I'm going to make sure we're doing it. So again, to our families, I want you to be vigilant. I want you to practice good hygiene, but I don't want you to disrupt your daily lives. Fear can be difficult, but there is no cause for fear at this time. And we are going to continue to communicate with the public about what we face here in Kentucky. But again, we expected this first confirmed case. We will work together. We as a state will get past this. Look out for your neighbors. Make sure that you check in on relatives, especially seniors. One of the things that Kentuckians do better than almost anywhere else is take care of each other. We had a 100-year flood in south central Kentucky, about a month ago. A 100-year flood, and we only had one fatality. Why? Because we had people stepping up and helping 100+ evacuations. That's the spirit of who we are. We need that same spirit from our people, not to back away, but to help each other as we move through this.
To the doctor, have we gotten to the point where there's the need to tell stores to limit like certain medications, the purchase of that, to keep a run from happening on stuff like that?
Before I turn it over to Dr. Stack, this happened late in the day. I will be asking the Attorney General, and we have not had an opportunity to do that yet, to activate the price gouging statute. That means people shouldn't be able to sell masks, sanitizers, and others and harm people that way. But I will tell you, we have not had the opportunity to reach out to the Attorney General's office yet. If this is how they're learning about it, again, my apologies, but we are moving as fast as we can. And as the situation evolves, as Dr. Stack talks about, we're going to make sure that we evolve with it.
Governor, maybe this is a question for one of the doctors. I know we have people watching this on the live stream or watching it live right now on television who are annoyed at the coverage of coronavirus. They feel as though the media and maybe some elected officials are blowing this up. You say there's a state of emergency, but stay calm. What do you respond to those people who are still maybe doubtful that this is going to be worse than the common flu, which has so far killed many people?
Right now, there is no reason to believe that this will be as bad as the common flu. 19,000 cases in Kentucky, I believe is the number, 66 deaths, including 4 children. So get your flu shot. And then everything else that you do to help prevent the coronavirus helps to prevent the flu as well. But this is new, and it's moving fast. I think the first inkling of it was in about December. And so you think about how it's spread and how it's spread around the world. We just want to make sure we're responding appropriately. When we look at the outbreak that we had just about a year and a half ago when it came to hepatitis, we want to make sure that we never under-respond. And especially with all the coverage that it's getting, yes, it makes it important that we continually update the public and that they know that we are doing everything we can to respond to it. I think part of keeping people calm, and everyone should remain calm, is to know that your government is doing everything it can and has every tool. I promise I will treat this the same way that I would for my own family. Being the dad of a 9 and a 10-year-old, I want to make sure that we're doing everything to protect our families.
Some of our health departments didn't have a great track record with hepatitis A. Some questions, are we prepared to handle something like coronavirus?
I want to make sure that I turn this over to the two gentlemen behind us, but I will say that the coordination from the federal government to the state government to the local government has been exceptional in leading up to it. We wanted more time, but as I mentioned earlier, every minute of time we had to prepare. These gentlemen and others were working very, very hard. We have wonderful people in our local health departments, and our job is to make sure they have the resources that they need, which I don't believe they had the last time. Secretary? Or
Certainly, and Dr. Stack. So in response to that, we are taking this, and actually to the previous question, we are taking this seriously. It's important to take seriously. We are bringing all the resources we can to bear. We have previously met with the National Guard. We are trying to make sure that the resources that we have available and our partners at the local level know everything that we are doing. This is fast. When the governor says we received this information today, it was like this afternoon. So we are trying to be sure that we are transparent with our local partners, with the healthcare providers, so that they can know we need to begin to respond, and that's exactly what we're trying to do. So I have confidence that with the leadership that we have in place, that we will be able to do that.
And our health departments are prepared.
We believe our health departments are prepared. We've been working with them now for a while to make sure that they understand what we're getting ready to go through, what this process will be. Dr. Stack, do you want to add?
Sure. I've been in regular communication with the health department leaders, the leaders of their association. I was out in eastern Kentucky in Pike County and in Knott County earlier this week, meeting with them in their site and with their staff members. They are really dedicated professionals, and they have been working very hard on our behalf. I do want to urge and ask the public to go to the Kentucky website that we've created. So that would be KYCOVID, KYCOVID 19.ky.gov. We're updating that data on a daily basis, and there's resources that continue to expand. There's custom resources relevant to Kentucky specifically, and also national resources that take you to the CDC website. I want to ask all the public to please take your role in this. Remain calm. It's okay to be concerned, but please remain calm. And please, if you're responsible for communities of people, schools, businesses, healthcare facilities, and others, please go to the website and look for the very specific information that's tailored to your setting. Designate someone to read that information and begin your preparedness, because we're all in this together and we will overcome this like we have so many other challenges in the past. But it's going to take all of us to remain calm and to be prepared. And so we're trying to make that resource available, and I urge you to share with your audience the need to go there and take an active role in this.
anybody else?
Have you, since we were in this room 2 hours ago
Yes.
for a media briefing?
I've learned of it in that period of time.
No, but the question is, have you been in conversation with the mayor of Lexington?
Yes.
Or Mayor Louisville, or any of the state lawmakers since we last spoke to you about this, or since you?
Since the time that we learned this and the quick turnaround, I've spoken to the mayor of Lexington. I've not had the opportunity to reach out to other lawmakers. Again, this is the type of information that gets out there fast, and we wanted to make sure we could present it in the appropriate way to where people are told you shouldn't be scared. We expected this. We're ready for it. We will respond to it. We will get through this together. Practice good hygiene and look out for one another.
Thank you.
One last thing that I would mention is I do believe that we are in a better place to address this than many states because of expanded Medicaid. I don't mention that because of my belief in expanded Medicaid, but it does mean that there is more access out there, that people will have less barriers to get service, and especially when we have our private labs up and running. I believe that it's going to make sure that if people are feeling sick, that they will get help. Thank you all very much.
Thank you, Governor.
Thank you.
Well, press conference